everyone, and thank you so much for joining us here today. My name is Jane Flanagan, and I am the Student Recruitment Officer at Tangent, Trinity's Ideas Workspace. And you're very welcome to today's webinar. This is for the Postgraduate Certificate in Healthcare Innovation. This is a Springboard funded course, and it's currently open on the Springboard website for application. So the purpose of this course is for students to come together from various backgrounds and identify opportunities for innovation that improve healthcare opportunities that can have a positive effect on healthcare, both products, services, policies, and processes. So we're joined today by one of Tangent's senior program managers, Rosemary Denneher, and she is chatting to Professor Dan Marr and Dr. Coleman Casey from the Health Innovation Hub Ireland, and they'll look at this course, an overview, discuss some of the topics of the course and give us an overview. So there will be a chance for you, the audience, to ask questions afterwards, and you can do so by popping them in the chat throughout as we go, and I'll put them to the panel towards the end of the discussion. So feel free to engage and ask questions as we go through. Okay, so without any further ado, I will hand you over to, I'll just stop sharing my screen. Bear with me a second. And I'll hand you over to my colleague Rosemary, Dan and Coleman. And thank you so much, all of you, for joining us today.
Jane, thank you for that lovely introduction. Hello, everybody, and you're very welcome. And just to reiterate what Jane said, we'd like to thank you so much for giving up your time and joining us here this lunchtime. My name is Rosemary Denneher. I am the Senior Program Manager here in Tangent, Trinity's Ideas Workspace. I work alongside Jane. And today we have a wonderful panel lineup where we're going to be talking about innovation in healthcare and opportunities for change. So we're going to be exploring at a high level, I suppose, new thinking within the sector and how can this contribute to Ireland's healthcare innovation journey. So what's our goal for today? Well, it's really that whatever role you are in the industry or whatever level you're at, that hopefully you'll come away with something. Maybe it's a new idea, maybe a fresh perspective on how innovation can help deliver improvements in the sector, and I guess how we can help you make that idea a reality. So just to reiterate what Jane said, and to give an idea of what to expect from today, here's the format for the session. So we're going to take a few moments now for each of the panelists to briefly introduce themselves and tell us a little bit about their expertise and their experience in the industry. I have some questions then that I'm going to put to the panelists, some high-level questions around trends and challenges, I guess, that we all should be thinking about at the moment. We'll touch briefly on the new course developed by Tangent in conjunction with the School of Medicine and Trinity College Dublin. And then we'll open up the floor to give our participants an opportunity to ask any specific questions from the experts, or if you have any questions as you go, if you put them in the chat box, and we'll take those questions then at the end. So if we're all ready, will we get started? Great, so let's start with the introductions. And Dan, if I could ask you first.
Thank you, Dan.
Yeah.
Yes, I had muted it to avoid background noise, which is a good idea, by the way, but not when you're being introduced. So again, my name is Dan Marr. I'm delighted to be here. I actually have spent my career working in many aspects of innovation, particularly medical and health innovation, both at the level of inside industry, inside entrepreneurship, and also within universities, where they're transferring technology out. But specifically, I am the professor associated with the medical school in Trinity in terms of innovation for our programs, which we're talking about here today. We can mention about the new certificate, which is very, very exciting. And I'm also in charge of the diploma course, which is a slightly different version of this, at kind of a more pointed version at a different level. But delighted to be here and look forward to the questions.
Thank you, Dan. And we might hand over to Coleman.
Good afternoon, and nice to meet you all virtually. My name is Coleman Casey, and I'm the Director of Health Innovation Hub Ireland. For those who are not aware of Health Innovation Hub Ireland, it's a government initiative sponsored by two government departments, the Department of Enterprise, Trade and Employment and the Department of Health. And our role is to seek out and look for innovators like yourselves and to facilitate their access to the healthcare system and to allow them to develop their ideas or their products or their services or their technologies to such a level that they get adopted by the healthcare system ultimately. My own background is that prior to this, I was the Director of Research for the College of Medicine and Health at UCC. And prior to that, I spent most of my working career in the pharmaceutical industry. I was running a plant for an American multinational company for the production of biologics products. So I'm very aware of the healthcare industry from a load of different angles, from the research angle, from the supply angle with respect to drugs, and also obviously now from the innovation angle. So that's me in a nutshell. So I'll hand back to Rosemary. Thank you.
Coleman and Dan, thank you for that. We're going to go straight into the question, starting with an easy one. Coleman might disagree. Coleman, if I could put it to you, just like in your opinion then, what's the current landscape or I suppose the appetite for innovation in healthcare in Ireland at the moment? And maybe a second part to that, does it depend, like most areas and industries, is it hugely depending on the setting or the individual organisation?
Answer the second one first, yes. But going to the first one, healthcare is probably one of the largest industries in the world, a huge number of employees. It is an industry and it is a very conservative industry. And it needs to be conservative because you're dealing with patients, you're dealing with people who are ill, and so it has to be conservative. As a result, then, innovation is all about change, and change is difficult. It upsets the norm. It also involves a certain degree of risk. So therefore, those two things, it's like an oxymoron. Do they go together? And of course they go together. And this has never been more evident to us with the recent COVID-19 pandemic, because as a result of that, it became really, really necessary to have efficiencies in the healthcare system. It became necessary to get new products in. It became necessary to get stuff approved. So as a result, there was a lot of change came in, and the healthcare system was very receptive to change. We've been working with companies for the past number of years, and we've been able to facilitate these companies to introduce them into healthcare. But the thing you always have to remember is there has to be benefits for both. There has to be benefits for the companies, and there has to be benefits for the patients and for the healthcare system. So that's why the Health Innovation Hub came into existence. As I said, it's based, supported by two government departments, Enterprise, Trade and Employment, but also Health. So it's really, really important that both of those are key players in the whole innovation system, because innovation is really, really necessary to bring in new efficiencies. And there's another part of this industry that people don't think about, and that's prevention. So prevention is better than cure. And in a lot of cases now, there's an awful lot of innovation coming in to prevent stuff from happening, such that the patients don't then come into the system and the acute system. That's where it's at its highest level. And wherever you look in business, in the real world, you will find there are pockets that are interested in innovation, there are pockets that are interested in research, and there are other parts that aren't. So our job is to find the pockets that are interested in innovation and to work with them to deliver something that's safe for everybody.
Super, thanks, Coleman. And I suppose it would be impossible to have a conversation like this without mentioning COVID. So we might get it in and get it out of the way early on. So Dan, maybe just to follow up on something that Coleman mentioned there, has COVID changed the landscape? And I suppose important to say, maybe for better, not only for worse, because I suppose we see plenty of examples of, innovation winning during COVID and during times of crisis. So, has it changed, and can we build on some of those positives going forward? Might just put that one to you, Dan.
Rosemary, thank you very much. I'm delighted to take that question because COVID has been seismic. I mean, seismic in terms of its impact, both positive and negative, in the sense that innovation has been given an opportunity to flourish in the most unusual places. Because healthcare, as Coleman had mentioned earlier, tends to be a conservative industry. I know I've worked with medtech companies and Coleman's worked with pharma companies and so on, and they're always at the leading edge and occasionally the bleeding edge of technologies. But within the day-to-day healthcare profession, obviously there's protocols, there's gold standards, and it takes a lot to bring new versions and new variations. COVID has forced the need for change. And people who would be conservative in nature have had to step up, and they have stepped up very, very well. So I take COVID in terms of the positive catalytic action that it has created, more so than the hard reality that we've all faced in terms of the isolation and in terms of the deaths, in terms of all this, which have personally affected many of us. And I don't want to take away from that. But in terms of a catalyst for innovation, I think it's one of the great world experiments that we'll be talking about for years and years, the before and after of COVID. And it has triggered innovation at every single level, not just at government level and at high level companies, but right down to every single individual. They're changing the way their modus operandi, and it is creating tremendous opportunities, particularly in healthcare.
If I could add in maybe, Rosemary, just to follow on from what Dan said there, and Dan will always know that I usually provide an example, but as an example of COVID and what happened, we opened an innovation portal on our website in the Health Innovation Hub. And in the 3 months of first months of lockdown, we had over 197 applications into that innovation portal. I'll just give one example. There was a fashion designer, believe it or not, a guy called Benny Musa, and he had a company down in Middleton in Cork called Benson's Workwear. They used to manufacture sportswear, schoolwear, and workwear. And he put an application into our innovation portal. And we triaged all the innovations and we said, this looks worthwhile. So we made contact with Benny Musa, and we had a really big conversation with them. And he was prepared to invest a lot of his time in the production of PPE, because that was the big driver at the moment. So we contacted him with the HSE. So at this particular moment in time, he switched everything over in his organization to the production of workwear. He's increased his workforce by 28 people. He was accredited, the first Irish manufacturer to receive CE certification for disposable gowns. He now makes disposable surgical gowns, disposable aprons, sterile surgical gloves, reinforced sterile surgical gloves, scrubs, tunics, lab coats. He switched everything across to healthcare. He's doing really well. He got the RTE Gold Star Business Award in July, and they're also now after purchasing 3 new automatic apron manufacturing machines that can output 100 units per minute. So there's 100 units, aprons per minute, over 3 machines. That's 300 units per minute they can manufacture. So that's a success story that didn't even exist before COVID-19. And he completely and totally pivoted his business to healthcare. So it just shows you that innovation is possible and is really flourishing in Ireland at the moment. And COVID was the signal for him to switch and to change.
Super, thanks Coleman. And just to say, you're doing my job for me here, because you just preempted, which was my next question, was maybe to give us an example. So that's terrific. I was going to ask for, a success story or a tangible example, brought about by implementing an innovative solution. So thank you for that. And I suppose important just to note, and you touched on it earlier on, it can be a product, it can be a service, it doesn't have to be you know, a career care pathway, for example, you know, but it can be in any of those different areas. And you've given a great example there of how that can work. So excellent, thank you.
Probably just to come in on that, Rosemary, probably the thing that has most changed for most of the people in healthcare that I deal with directly is the idea of telehealth. Everything that was physical kind of pathway and flow of patients, particularly patients outside the hospital, into any form of sort of medical discipline has changed. And again, it is about process innovation, although it is technologically enabled innovation. So the use, as we are right now, using technologies at a distance to communicate and dealing with patients. And these have been very, very successful. And a lot of people that I've seen, it doesn't actually matter about the discipline. Even things like physiotherapy, which you would think is very much a hands-on activity, it turns out that maybe, you know, 70–80% isn't actually the hands-on part. There's more the communication part, etc. So there's new modus operandi in terms of how people are approaching this, which has been triggered by COVID. So it covers the full range, but certainly that operating at distance telehealth is one of the top levels that we would see on a day-to-day basis.
Super, thanks, Dan and Coleman. So Dan, if I could stay with you just for a moment and maybe touch on the course. So you've partnered with Tangent to deliver the Postgraduate Certificate in Healthcare Innovation. I guess the question is, and for people listening, who would want to do this program, or maybe more importantly, for those listening who are considering doing the program, like why would I want to do this course? Yeah,
I think you need to maybe put yourself in the mind of everybody who's actually working in healthcare at the moment. They have been overstretched. They've been very, very deeply involved, obviously responding to COVID. They've seen innovation come at many different angles in other parts of the health services. And yet maybe within their own world, they're wondering where exactly will innovation touch? And there's a bit of a fear factor suddenly, which is sort of, well, the others know kind of more about how to handle this. But in the idea that we have here and what we've seen with all our other programs is that innovation is not belong to any one strata of an organization. In fact, it can occur at any part throughout an organization. So even within a hospital, everybody from clearly top consultants, so on, you would think would be coming up with ideas, but no, it's at the porter level, it's at the finance department level, it's at the nursing level of every type, it's at whoever's organizing the roster level. It is really quite pervasive. And so when a person is in those organizations and challenged, and they're usually challenged by, I don't have enough time to do what I'm already doing today, the idea of taking an innovative approach to release some of that kind of energy onto rejigging, reforming maybe how we work. And it's not just about inventing new medical devices, it's about inventing maybe new processes. So we are encouraging people to consider it because these are the kind of key elements of this particular course. And one thing I would say from experience is we already know that 75% of the people who do courses like we're talking about here with our new certificate tend to be looking at process innovation and not product innovation. So if they're worried that, you know, I'm not really into developing the next drug-eluting stent, that's not what it's about. It really is about process innovation. And so therefore, everybody in our most recent kind of diploma level where we have people on this, again, 75% would be process innovation, rethinking from fundamentals how we approach doing this. In fact, money is often presented as the answer to most problems. And my experience is most problems get solved by taking the money away from the problem because it forces you to actually consider the best solutions. And then by putting money back in, it's really an investment to achieve it. So I think this course will be ideally suited to a person who's been thinking about innovation, has been observing innovation going on, probably questions themselves as to whether I could also be innovative, and that this course will allow them to really understand and get the key skills which allow them to look people in the eye confidently and really understand the problem, not just from the one passionate area that they're focused from, but have a broader perspective so they can better present their ideas for innovation and actually get buy-in for those ideas.
Super. Yeah, no, that's really interesting. Coleman, could I ask you, in terms of the challenges, like what would you see as the one biggest challenge or the biggest challenges or barriers, I guess, in trying to implement innovative solutions in healthcare at the moment? And again, the second part, which is definitely not the easiest part to this question, how can they be overcome, and can the course address, some of these issues and concerns?
Yeah, I think you have to look at the whole healthcare innovation pathway. It starts with an idea and it ultimately ends up with an adoption, which is a new product or a new service or a new technology. And the challenges are that what we find is we're involved in a number of different initiatives. We're involved in a program called Spark Ignite, where we're trying to encourage people within the healthcare system to come out with their ideas. And a lot of people that we deal with, they have the right idea. They have a great idea and they're close, they're upfront, they're working at the front line. They can see what's wrong with the system. But it's one thing having an idea, it's another thing bringing that into something that will actually end up in a product. So there's a lot of challenges there because people are overstretched at the moment. They're working at the front line. They're doing an awful lot of their core activities. And to put time aside to look for their idea and to develop it. In a lot of cases, they may not be able to develop it. They don't want to develop it and they want to bring it into the system to take note of it. They might look for research funding. They might look for contacts. And again, we help people in that. We will help them to do a technology assessment such that you can see whether this has potential or not. We force people to look at the business end of it. Who's going to buy this ultimately? That if you want to make your millions out of it, someone's going to have to buy it. So the bottom line is there's a lot of work involved in that. And the challenge is it's no good just having an idea. What you have to do is you have to turn it into something. And to bring that into a system then that's conservative is a big challenge. So what we do and how we overcome this is that we will seek out a clinical location that is interested in that idea, that sees benefit in that idea. And then we will work with the individual or the SME or the small company to bring it in and to test it and validate it within a clinical environment. In some cases, far removed from patients, parallel to what they're normally doing. And the company will have to do that free of charge. But what they're getting back in time is they're getting back the time of the clinicians. So again, we can give them information, we can give them feedback, we can give company feedback. So that challenge is they can't get access. And I tell an amusing story from time to time of we were dealing with a particular company and they were very much into the sales hype. And that's often a problem because you're speaking a different language to the clinical team. So you're coming into a clinical team and you're trying to sell the best thing since the sliced pan as you think it is, but the clinical team might not think that at all. So our job is to find the clinical team who have an interest in that particular product. So that's the first challenge. So when you find that clinical team, then we will speak to the clinical team, then we will speak to the company and we will forge the first meeting relationship and draw up an agreement to do a pilot study. And we were dealing with a particular company and we said to them, look, that's fine, but they were big into the sales hype and everything. And we said to them, leave us, it's sold. The clinical team want to use it. There's no selling required now. The clinical team want to use it. But the default for the company is sell. And then the individual involved started the discussion and he kept going and he mentioned the platform and this platform. And next thing the consultant said, stop. And everybody went silent. And he said, a platform is where I catch my train. So there was a language difficulty, there was a language barrier, there was a misunderstanding. So then he handed over to us and we facilitated that whole thing from start to finish. And the company did get in, and the company did their study. So all of that worked out well. But there are the challenges, because you're dealing with different groups, you're dealing with business people, you're dealing with clinical teams. And to us, it's not all about the consultant. It's about the clinical team, because the consultant, he or she may want this, that, or the other, but if the rest of the team aren't behind him or her, then it ain't going to happen. So we have to work with the team and ensure that the team work together. And they're the big challenges that I see. But if you find the right team, you find the right people, you can then match them with the company, and then you have like-minded souls working together. And that to me is the big challenge. And once you have that, you have the magic potion. And now we have a big database of people that we feel are very good for piloting and trying out new ideas. I do want to stress for the people that are listening, we do not do clinical trials. That is done by the clinical research facilities throughout the country, but we can refer people on for clinical trials, etc. But we don't conduct those. We conduct validation studies and pilot studies.
Great, thanks, Coleman. And I love that very simple idea of, when it came down to it, it was maybe just communication. So a bit like in other walks of life as well, maybe not unique to just the healthcare industry. I love that. So thank you for that example. I just have one more question, because I know we have a couple of questions coming in, and I have an additional question here from the audience as well. So a bit like the presidential pitch, if I asked you in 2 minutes, what is your dream or your vision for the future of innovation in healthcare in Ireland? What would you say? Dan, I might go to you first.
Yeah, our vision actually is quite clear. What we would like is that people themselves become highly motivated to take action on their ideas. And one point I want to stress is, innovation doesn't necessarily mean that you have to have your own creative idea. The innovation is about taking action on the creative idea. So the good news is, you don't have to be an inventor to be an innovator. And that's a very important message. And once people understand that and can figure out what's actually good about it, then they can take action. But the key word is taking action. An idea without action has no value. Absolutely no value, no matter how brilliant the idea is. It's the taking action. So what we want to encourage within the healthcare system is that each individual begins to feel empowered to put forward their ideas and take even the minimum of action to test it out, rather than being, and I'll finish with this, rather than being the classic situation, which is, if we represent it with a beautiful, very glowing light bulb of an idea that you present, and then slowly people start to say to you, your colleagues as well, look, I think we tried something like that before. Somebody else said, I'm not sure top management would go for that. Or worst of all, that's really the most stupid idea I've ever heard of. They can completely dim and kill innovation, right? And so what we want to do is to encourage people to think, to be proud, but at the same time to be knowledgeable, to bring forward their ideas, to take action, even if it's only a small action on our ideas. So that's our ambition within this program. That's our national ambition, is to encourage everybody among, let's say, the 100,000 or more people even in the HSE, to sort of begin to consider and take action. And money is not always the answer. You shouldn't start by saying, if I had the money, I would do this. You should start as, this is what we should really want to do. Here's why it's a good idea. And believe it or not, money tends to follow good ideas. So presenting the good idea is the most important part of the whole process.
Great. So action is the key there. And Coleman, could I put the same question to you?
Yeah, I guess my vision would be that the people who are listening here today and who do this course will become ambassadors for innovation. And they will go back to their workplace, they will go back to their healthcare setting, and they will say, there's a better way of doing things. There's a more efficient way of doing things. Let's not just keep things the status quo the way they always were. Let's be adventurous. Whilst not being dangerous, we have to remember who we're dealing with. You really have to measure and mitigate your risks very, very carefully. And I will cheat here. And what I will do is I will use a quote that I got from Benny Musa, who I mentioned earlier. And this is something that he said that really hit with me. And to me, that's the ambition that I have as well. Yeah, and what he said is, we have made this project a priority to respond to the national and the EU gown requirements due to its urgency, and are pleased to advise that all our gowns will now have the attached CE neck label and made in Ireland. This achievement, combined with our production capacity to date, will mean more business and more manufacturing in Ireland and exporting our goods to EU countries instead of importing from the Far East. So that was how Benny viewed it. And I think, to me, that's what this is all about. It's about Irish business. It's about Irish healthcare. It's about us having a presence on the national and international scene, and our influence being, it was remarkable seeing yesterday on the TV, Michael Dowling, who originally came from Limerick. He's the head of Northwell, and he was standing there witnessing the first COVID-19 vaccination in the US. And I heard him speak up in the Aviva Stadium there a few years ago, just about 2 or 3 years ago, and Limerick had just won the All-Ireland final. And he used to play for Limerick, and he actually choked when he was talking because it meant so much to him. He had to leave the year before they won the league, and he played on that team, and he had to leave to emigrate for his career. And he went to the US, and he fondly now is celebrating Limerick, and he's celebrating again this weekend. I heard him on the radio. So it's remarkable to see that's our impact globally. Our impact in healthcare innovation should be exactly the same. We should be the leaders, and we should look at these local industries who are actually promoting us internationally. We want to be an international presence and an influencer. That's my vision for innovation in healthcare in Ireland. It's not national, it's international.
Oh, super, Coleman. That's a lovely way to end there. And I just realised I put you both in the shoes of our students. And just for anyone who's listening, so pitching is actually a core part of our assessment strategy. So we've joined the ranks of the students there for a while in answering those questions. Thank you both very much. I'm going to hand you back over to Jane, because I know there's a couple of questions coming in on the chat, and I have one as well. But I'll hand you just back over to Jane there for a moment if she wants to give us some of the questions that are coming in, and we'll get those answered, hopefully.
Thanks, Rosemary. Yes, thank you. And some great questions coming in. Thank you so much. It was really informative chat. Great to see such a wonderful course in a much needed sector, innovation in a much needed sector. We have a question here from one of our attendees, and he is a healthcare assistant working in Beaumont Hospital. And he speaks a lot about, he works as a carer and how he has learned a lot from dealing directly with the patient and user experience and all of that. But he says that every project product comes from, as a low-level staff, we think we can innovate in so many ways. I addressed a few things before the managers, but nothing happened as people don't like change. I found Healthcare Innovation Hub. I hope that they will help execute our ideas into a reality, as we are not given the opportunity to excel in the areas of innovation. So what do you have to say, maybe, Coleman, to that? Change is difficult, and you often don't get the buy-in from managers and so on.
Never give up. And it can be difficult. And look, healthcare is the same as any other industry, any other environment. As I mentioned, I was in pharmaceutical business, and that's as conservative as healthcare. It is part of healthcare. And the thing is, we still innovated, we still changed, we still looked at different ways. Automation was a big innovation for us, getting automated systems in. Obviously, workforce don't like that, because automation can be viewed as threatening, and but it actually improves the outputs, improves the performance, improves the environment that people work in. So there's always ways of getting change in. It can be difficult. You have to knock on doors, but that's why we're in existence. We're there to try and look and help people. If there wasn't a need for us, obviously we wouldn't be funded. So we're being funded to do that. We're being funded to match people. And we do have an innovation portal on our website. So anybody who's got an idea or a new innovation, they put it onto that portal. It's very easy to fill out. You can see it. We've made it as easy as possible. And then what happens is our team will triage that innovation. We look at it, we'll see, has it got merit, and we will then put people in contact with the relevant people who can help them. So if it's not working for you in your own environment, you might find there's another environment, and we might find a place for you that we could actually look and match you. I often say we're like a matchmaking company. We can bring a couple together, we'll bring them up the aisle, but there's no guarantee that it won't end in divorce. Hopefully it will end as a happy, long sort of relationship, but sometimes it doesn't. And the bottom line is, you know, we had a very good example of a person who came to us. It was a porter in a hospital with a great idea for moving beds around very easily, because it was taking 2 or 3 people to move beds. But the problem that we found when we looked into it is that those beds were specific to that hospital, and all of the newer beds had all been changed. And that innovation that was suitable for his hospital, unfortunately, because bed technology had changed in time, it wasn't suitable for most of the new beds that were coming in. So whilst it was a great idea and it was very beneficial in that hospital, it didn't have the capacity to grow from there. So there will be ideas, there will be things, but if we go with you, if you come to us, we will help you to assess that technology, assess that idea, and see whether it has merit or not. So please feel free to come to our website and put in your innovation.
And I think that's one thing on the course I'd like to stress actually as well. What Coleman said there is that there is this idea that our ideas or my idea isn't getting heard, is, you know, that I have a great idea, nobody's listening, etc. One thing on the course that we actually put a lot of emphasis on is trying to have an objective observation of our own idea. In other words, rather than the pure passion of our own idea, we also try to think of the idea from all the other stakeholders that would be involved in making the decision to support the idea. So one important element, therefore, in our course is to help individuals actually think through the logic of how their ideas get funded. So it's not just about the passion and roaring louder, it's actually about thinking from the perspective of each of the stakeholders, not just the patients, the doctors, the hospital administration, could even be the insurance company, etc. There's many different stakeholders. So I think one thing I would encourage people to think about on this type of course is that idea of a kind of an objective consideration. And they'll be in a it doesn't change their idea, their passion. We don't kill their passion. What we'd love to do is add pragmatism to that passion. And that really is one of the objectives in the course, to encourage them so they can figure out how to recondition their idea and potentially represent their idea in a light that actually will attract a lot more action from those who would be supportive to it.
Great, thanks, Dan.
A couple more questions here. So is it possible to continue your full-time job whilst working on the course?
So I can answer that one, Jane. Yes, it is. So the course will be run over Saturdays. It will be block delivered Friday afternoons and Saturdays. We'll have a definite schedule, and if they want to email you, Jane, probably, or springboard@tcd.ie, we can give them all further detail. But absolutely, I think I see a question there. Would somebody need to leave their present job? So no, they wouldn't. They can continue to work. And in fact, we would highly encourage people who are working within the setting and to bring that experience into the classroom.
And are the HSC linked with this course in any way?
Are they?
That's one question here. Are the HSC linked with this course in any way?
I think it's hard for me to figure out what the link is. They're absolutely linked in the sense that we work directly. The Health Innovation Hub that Coleman can certainly chat in great detail about is, the HSC is one of the partners of it. In what we're doing in Trinity Med School, where we're delivering innovation, we're working directly with the HSC. So in fact, when we're actually designing the course, we actually have designed it completely with the HSE in mind with respect to what they actually would need. In fact, one of our metrics in general in the bigger picture of this is actually connecting with the HSE. Coleman, you've actually got that as a very specific metric, don't you?
Yeah, absolutely. And I think what we have a national oversight group, and on that group sits the Department of Enterprise, Trade and Employment, the Department of Health, the HSE, Enterprise Ireland, SFI, the HRB, and the IDA. So we've got a fairly powerful sort of lobby group there. And what we do with that grouping is we update them all the time on our metrics. And we've got metrics with respect to attendees at different courses that we do. We have metrics on our sort of successful companies, and we present all that data to them. As a result, then we advertise through the HSE for courses. So once this course is up and running, again, we will use our system to advertise that particular course to within the HSE. So that's really, really important for us, because we want to attract in people from the healthcare system. So that's how we will do it.
Yeah, and I suppose just from the shoes of a person considering the course, if the question is, would the HSE be approving of me doing the course, and would they see it as positive? I think the answer is definitely a resounding yes on that. Okay.
Thank you, Dan, and thank you, Coleman. We have another question here. Is the course suited to non-healthcare professionals who are innovators?
Well, I won't jump in totally, because in fact, I think Tangent could even better answer that question, because you can cover the full range. But what I would say is, yes, innovation is a universal activity. There can be innovative in every discipline. However, on this course, we actually have geared it towards the healthcare professional. Now, that could be broader than maybe people working clearly in hospitals. It could be into medtech companies. It can be into people who have medtech or medical associations, healthcare associations, even people working healthcare insurance or whatever. So it can be quite broad, but it's not focused for a generic kind of innovation program. In fact, we've absolutely attuned it using the fundamentals of innovation that are indeed applicable. However, I think Rosemary yourself could probably give you an even better answer.
No, I think Dan has covered it off there. I mean, this is, developed and will be delivered with the healthcare context in mind. Tangent does have a range of other programs, both in more generic areas like creativity, innovation, entrepreneurship, that are not discipline specific. We also then have other particular areas like climate entrepreneurship, that we're bringing on courses in as well. So I guess it really just depends. As Dan said, it would be remiss not to point out, I suppose, that it's not just for medics or clinicians. I mean, we're looking at administrators, professionals, practitioners across every level and sector within the healthcare, but it is mainly geared for people within the healthcare sector. Delighted to talk to that participant just in terms of, maybe their career path, or even in terms of, their next steps, instead of in terms of their progression study, because there may be another course that Tangent can offer that may suit them, or indeed it may be this one.
If I could add maybe that I think linking those two last questions together, the thing that this course offers is it offers an accreditation, it offers an award. So at the end of it, you are getting something out from Trinity, from the School of Medicine, that actually says you have achieved this standard. So to me, that's really important, whether you're the HSE, whether you're involved in business or whatever, you're getting something that has gone through the rigors of approval within an academic system. And that to me has a huge amount of weight. So for me, that is really the big target here, that you're coming out with an accreditation, a level 9, based on doing this course. So that's really, really, I think, the important point. So be it business, be it health, be it whatever, it's still an accreditation, and that's the important thing, and it's gone through a rigorous approval process.
Great point, Coleman. Thank you for clarifying that. Okay, and that's all the questions to, oh, so will the course be recorded? Has just come in there. So I suppose I could even answer that one. Part of the criteria for getting the level 9 postgraduate cert is that, and that's part of the springboard criteria, is that you are in attendance at least 80% of the time. But due to the amount of group work and interactive work on the course, we would like you to be there 100% of the time. However, we do endeavour to record all the classes so that you can watch them back if required.
Yeah, I would just reiterate that. I mean, participation, it is, you know what I mean, like it is active learning, and participation in the classes and in the group work forms a large part, both of the coursework and an integral part of the assessment for the programme. So we wouldn't be encouraging people just to record them and watch it back, you know, at a different time.
No, absolutely not. And because I've been delivering these types of courses, and participation is absolutely critical. And the only reason when we're recording it is to really help those exceptional situations where it just absolutely wasn't possible to be in attendance. But if a person was suggesting that, no, I will not attend anything and I will watch some videos and I'll read some books and I'll sort of apply, this is not the course for them. What we want are action-oriented individuals. And this is, in addition to what Coleman said, and it's kind of ironic that I'm actually saying it on the academic side of this equation, but in addition, let's say, to the academic accreditation, for me, the real success of this program is, as we originally said, is that the people are converted to ambassadors of innovation, going back into their environment, working with their teams, creating even virtual teams, prototyping their ideas, moving their ideas forward, and feeling very confident to look people in the eyes, to present their ideas, the valid aspects of their ideas, and really do that with great confidence. So in order to do that, attendance is critical. We always find that the people who are most active and most engaged directly with the program tend to be the ones years later, when we're looking at the alumni who are still the active people out there taking action and getting things done.
Absolutely. It's definitely not a sit down the back of the class and take your notes type of scenario. So it's good to get that out there now. I see a couple of questions coming in there just around start dates, end dates. So Jane will be able to type those answers into the chat box. We will have a further information session or two between now and the course start date, which will be specifically around the course content, how it's assessed, those kind of questions in terms of fees, start dates, end dates. So, I think Jane's going to put up, thank you, Jane, she's going to put up the details there. I suppose just before maybe we do that and I hand over to Jane for wrap up, I want to thank our panelists today, Dan and Coleman, for just a really informative, I've certainly learned a lot. If I was to sum it up, which I'm not sure I would be able to because there was a lot of information there, but I think what I took from it was we are all innovators, or at least we can all and should be all aspiring to be innovators. Back to your point, Dan, I think money is not necessarily the answer. Action needed. And I love Coleman's point, which can probably apply to many different things in life, certainly at the moment, and that's don't give up. So I'm going to hand back over to Jane. Thank you all, and thank you to all our participants for coming on. We will be online there to answer those last couple of questions, just conscious of people's time and their lunchtime. I'll hand over to Jane there, who will have just some further information on some follow-up sessions.
Thank you, Rosemary. Okay, so we have another questions and answers information session happening on this course on January 21st. So you're all very welcome to come along to that, and you can register for that session, that webinar, if you go to the link bit.ly/open evening healthcare. So do register for that and come along, and we'll discuss the course again in more detail and the application process and so on. And for further information on the course, to learn more about that, you can go to bit.ly/event healthcare. And then finally, I have the link to apply here, which is springboardcourses.ie/details/8279. So all applications for the course must come through the Springboard website. So it's important that you upload the required documents there. And any questions regarding application, please send them to springboard@tcd.ie and I can answer you from there. And that's it. Thank you so much for your time. Thank you to our panel and thank you to all our attendees. It's really great to have you all online with us today, and hopefully we'll speak to you over the coming weeks and hopefully see your applications come in for the course. So thank you. Thanks very much for your time. I'll leave it there.
Thanks a lot.
Thank you.
Thank you.
Our pleasure. Look forward to meeting with you all in the future. Bye for the moment.
Thanks. Thank you, Dan.
And any questions, I'll stay on for a few moments and answer any questions here, but the rest of you can drop off. But if there are further questions, just direct them to me at the springboard@tcd.ie. Thanks, guys.
Thank you. Bye now.
Super. Thanks, Coleman, Dan, and thanks to all our participants.